While the White House prepares and plans for the coronavirus, local health officials are doing the same.
And at the same time, they're trying to keep the public assured. News 8's Joe LaFurgey's in studio control with our story tonight. Joe?
Yes, Brian. Some concerns over coronavirus are legitimate. Others have taken on a life of their own. Local health providers are offering one important piece of advice.
Don't panic. Yeah, this is, the states are planning, the feds are planning.
Which may be easier said than done, especially when talk of a worldwide pandemic accompanies images of moon-suit-clad crews spraying down public sites with bug killer in countries abroad pop up in our news feeds every hour. It's created a challenge for local healthcare providers.
How do we communicate out to the community and help them understand what's the best way to stay safe?
As head of emergency preparedness for Spectrum Butterworth Hospital, Julie Bolson is pretty good at separating fact from fiction.
Inevitably, the numbers are going to increase in the United States. We expect that. The mortality rate right now is less than the flu. And the severity of the disease right now is less than the flu.
Hospitals have a plan evaluating patients who walk through the ER door fearful they have the virus by first asking questions about their potential for exposure.
Have you traveled internationally over the last month? Should you say, yes, I've traveled to mainland China, they'll provide a mask to you. They'll bring you into an isolation room.
And exposure with no signs of the illness will keep a person quarantined at home for 14 days. Blood tests confirming they have the illness would put them in an isolated hospital room at Spectrum. That's if an actual coronavirus case is discovered in West Michigan. The good news, the methods for preventing the two are one and the same.
Good basic hand hygiene and flu etiquette. If we can continue to get that message out, we'll be fighting both diseases at the same time.
And the best information on coronavirus comes from sources like the CDC, as well as state and local health departments. We have links to all of them at woodtv.com.